Every day passes in this pandemic and the frontline fight to contain the coronavirus rages on. In the background, the world's greatest minds are working around the clock on a vaccine.
This morning we have a clearer picture for you of where the vaccine race is going and the challenges for the world, even if there is a breakthrough. Today's Jess Millwood has the story.
It's being touted as our ticket out of this coronavirus nightmare.
It's just a matter of continuing to practice the discipline, to stay in the habit about contacts and about keeping distances. We must keep doing that until there is a vaccine.
Here is the state of play on the vaccine race as it stands this morning. There are 199 vaccines being developed right across the globe. 25 are at the clinical testing stage, 17 being tested on humans. The medicine industry has never been in this position before.
We have only got approved in general human use less than 100 vaccines through the whole of medical science and research. Now compare that to drugs. We have tens of thousands of drugs that have actually made it through those pathways. That's how tough this is.
And Australia isn't just in the vaccine race. We are one of the front runners with a number of clinical trials in the human testing phase, including one here at the University of Queensland that's looking very promising. University of Queensland scientists started working on their vaccine on January 10, the day the genetic sequence of the COVID-19 virus was first made public. Now, in the human trial phase, 120 volunteers are taking part.
We're taking blood every 2 weeks. They also have an app, so for 7 days after they receive a dose, they enter in any symptoms, any headache, any issues that they're feeling.
It's expected the results will be clear by the end of the year. At the Royal Adelaide Hospital, a joint project with Flinders University and biotechnology company Vaccine is also now at the human testing phase. 40 people between the ages of 18 and 65 are taking part. The Novavax vaccine is the third to be tested on humans in Australia, but it's the vaccine being developed by Oxford University in the UK that's said to be leading the way at this stage. Trials of the experimental vaccine have found to be safe and generate a strong immune response in humans. That jab could be ready by the end of the year.
We will know over the next couple of months with a greater degree of confidence whether we are seeing vaccines that will work.
But even when we have a successful vaccine, potentially even a couple, there will be issues. Health experts are concerned about fair access to the jab, some countries making it a condition of development that their citizens get first go.
But I would still like to think that there'll be fair and equitable use in the parts of the world that could benefit from it the most.
That being the developing countries where healthcare is poor and governments can't afford to enter a bidding war for a vaccine. It's predicted 20% of the world's population will need to be vaccinated, 1.5 billion people, for there to be a global protection and therefore the return of free international travel.
We are going to have to wait and see how countries behave and how our political process could actually work through this. As we know, this is a very challenging exercise.